Hi, I'm Debra Hesse. I run the Cancer Survivorship Program. I'd be happy to show you around. We have an amazing facility here. When I started working and running the Cancer Survivorship Program, there really weren't very many Cancer Survivorship programs across the country. We were one of the first in America because when people heard that they have cancer, it was often a death sentence. And today it's a chronic disease. In fact, there are 12 million Americans who are living with cancer. So we have this lovely new situation of people living with cancer, and how do we help them live well with that? In fact, we tell people that it's really a new normal. You'll never be the same once you've been told that you have cancer, but you can be a better and stronger person because of it. If you come in entrance 26, you'll notice the wall that has all these lovely pieces of stained glass, and that's where we've engraved the names of people who have been donors to not only St. Mary's Cancer Center, but also the hospital. So it's our way of recognizing them, but I think the stained glass really makes it beautiful and appealing to see. In fact, every other month I have an art exhibit in the lobby, which really turns this entryway into a gathering place. Patients will stand here and look at the art and visit with other cancer survivors and find a friend and maybe cry a tear. One of the exhibits that we have often in the lobby is our Putting a Face on Cancer. I found a fellow melanoma survivor from Glenwood Springs, Sue Drinker, and she does the photography, so you'll see that they're black and white portraits, and she has this amazing ability. When you look at these portraits, you really are looking into the eyes and the souls of the survivors. All of us who have been told you have cancer, we share something that you don't share with other people. When I visited with other cancer centers like on the Front Range, they always tell me how impressed they are with all of the things that we provide for our cancer patients, and I let them know that it's not like our patients can drive across town to the other cancer center. I take it very seriously that when they come to my cancer center, if we don't have the resources for them, they're not going to get them. And so it's a very big responsibility to provide everything that a person's going to need, that you will need as you're going through your cancer treatments. My job is to give you resources, to provide support for you, and make sure that we do everything possible to make your walk with cancer a little bit easier. My office is in St. Mary's Library and Resource Center. In our library, I have a patient access computer so that you could come in if you want to check your email or do some research or print something off while you're in the cancer center. I also have 2 walls that have a free educational literature specific to diagnoses, symptom management, like how do I tell my kids I have cancer, how do I combat fatigue, what foods should I be eating. I also have free hats and scarves, so you can come into the library and see if I have a hat or a scarf that would help you feel better and more confident about yourself. At the Cancer Center, we have 9 different support groups that we offer. We have free yoga classes, free art classes, free qigong. Specific to diagnoses, we have Breast Friends for women with breast cancer. We have the leukemia and lymphoma group for those who are dealing with blood cancers. We also have the Macho Men, which is Men Against Cancer Helping Others. That's for men who have cancer or their wife has cancer. We have a new group, which is Cancer Chicks, and that's for young women who are coping with cancer. When you are in your 20s and told you have cancer, it's a very different place to be than when you're in your 50s or 60s. And so this group really addresses the fertility issues and self-image while I'm still dating, and helping them through that particular time in their life to be going through their 20s and going through cancer treatments at the same time. Located right next to the library is our reflection room, and some of our smaller support groups meet in here. It's a very intimate room, but I think it also communicates our determination to provide not only high quality but also very nice comfort. A lot of my volunteers are also cancer survivors, and so when we're visiting with you and assisting and helping you in every way that we can, there's a different connection. And I think that there's also an inspiration, a little encouragement, because the patients feel like we saved their life, and they're connected to us on a very personal level. We are like a family. Usually when we see our cancer patients, they're going through their treatment, but then we see them in 3 months, and we see them in 6 months, we see them in a year, we see them in 5 years. So we know them for many years. We know their kids, we know their dogs, and they know us. So we're very close. It is about hope. With the treatments that you'll get at the Cancer Center, with the amazing facility that we have, there is so much hope that you're going to be just fine, and we will walk alongside you as we go through this journey together.